Thrombosis, also known as blood clots. Welcome to Children's Hospital Los Angeles. Please pay close attention to this video for important information about blood clots. Hello and welcome to CHLA. I want to be sure you know about blood clots. As you get ready to go home, the hemostasis and thrombosis team will continue to care for you and your child. This video will explain what you will need to know about your blood clot and its management. Please ask us any questions if you need to. Feel free to take notes as you watch this video. Thrombosis is a medical word for blood clot. You may hear your healthcare provider use either word. A blood clot happens when your blood or platelets stick together. Blood clots can be good, like when they help your body stop bleeding after you get a cut or a scrape. Blood clots can be harmful if you get them in your veins or arteries. The most common places where blood clots can be a problem are the arms, legs, lungs, and brain. There are many reasons why you can get a blood clot. The more common reasons are genetic blood clotting disorder, central venous catheter or arterial line, cancer, not able to move for a long time, also called immobility, infections, autoimmune disorders, certain medications, surgery, pregnancy, serious illness, obesity. Your healthcare provider may tell you about other causes for getting a blood clot. The symptoms of a blood clot can be different depending on where it is in the body. Pain, swelling, warm to the touch, not able to move as well, discoloration or purple color of the affected arm or leg, absent or weak pulse. Chest pain that becomes sharper when taking a breath, squeezing or heaviness. Some people describe it as an elephant sitting on their chest. Shortness of breath, or you can't catch your breath. This may happen for no reason. Quick breathing, discolored skin. Unable to speak normally. Hard time moving one side of your body. Vision changes. Changes in your personality. Seizures. Headaches. Part of your face doesn't work like the other half. HTC stands for Hemostasis and Thrombosis Center. This center treats kids with bleeding and clotting conditions. You'll hear us call it HTC for short. How do I make an appointment at the HTC? If you do not have an appointment on your discharge instructions, please call 323-361-4624 and ask to make one with the hematology team. Where do I get my blood drawn for testing? Go to the lab in the Anderson Pavilion at CHLA for your blood work. Where do I get my blood drawn? You will probably need a timed blood draw depending on your medication. If you're not sure, ask your nurse or doctor before you are discharged. Make sure you arrive at the lab draw station about 30 minutes before your appointment. When you check in, tell the staff what time the blood should be drawn. If you have a central venous line, be sure to call HTC at 323-361-4624 so we can arrange to have your blood drawn from your line. When should you call the HTC? You should call the HTC for a fall or hit to the head or stomach, a change in the color of urine from yellow to dark or red, bowel movements that are dark or black in color, vomit that has bright red blood or looks like coffee grounds, a lot of bleeding from the gums, nosebleeds that last for more than 15 minutes, bleeding from cuts that lasts for more than 15 minutes, bruises that you can't explain, or a lot of bruises on your body. If you're having a procedure, surgery, or dental extractions, your medicine may need to be stopped. If you have an emergency, dial 911 and then call your hematologist. Program staff is on call at night and on weekdays, weekends, and holidays. If you need to reach us after hours, please call 323-660-2450 and let the operator know that you'd like to speak with a hematologist on call. Always call us even if you're not sure if it's an emergency. When to call for help. If you or your child has more bleeding than expected. In this video, you learned what a blood clot is, why people get blood clots, signs and symptoms of blood clots, how blood clots are diagnosed and treated, how and when to contact the HTC. Still have questions? Please talk to your doctor or nurse before you leave the hospital today.